Hello, my name is Brendan, and I'm going to be giving you a walkthrough of the Claio Scribe platform. What you're seeing now, this is your dashboard. I like to call it the home screen. This is where you're going to want to be when you have patients coming in and you're getting ready to start your transcriptions. Then we have our transcribing tab on the left. This is where you're going to be able to see all of your previous visits as well as patient profiles. Next, we have our calendar tab. This is going to sync with your MacPractice calendar, and you're going to be able to see all of your MacPractice appointments here. Usually just takes a couple of seconds to load in. As you can see, this syncs up with the MacPractice calendar. These are all patients that I have scheduled in for today. Then we have our templates tab. This is where you can upload and generate templates that you're currently using or custom build new templates inside of Claio. My recommendation is that you send your templates that you are currently using with MacPractice over to the Claio team, and they will help you custom build templates that will work alongside Claio. Then we have our coding tab. This is where you're going to be able to generate all of the ICD-10, CPT, and HCPCS codes. And then we have our settings page, but we're not going to be going over that today. So back to the dashboard, and we can get right into how to start transcribing with Claio. So we have Andrew Johnson coming in at 2 p.m. To get started with the visit, you just want to click this blue Go to Visit button. It's going to automatically fill out the patient information, so there's no extra steps. All you need to do is select your note type. We'll be doing a SOAP note today. Select your language. I'll be doing English. Note length, I'm going to set it to standard, but you can choose concise if you'd like a shorter note or detailed if you want longer. And then when you're ready to get started, you just want to click that green record button in the top right. Hey doc, I've got this tooth that's been hurting over the last couple days. Okay, tell me exactly where it is and what it feels like. It's on the top right. It's a sharp pain when I chew, and it's been really sensitive to cold. Got it. Any swelling, bad taste, or pain that wakes you up at night? No swelling, but I did notice a weird taste once in a while. It hasn't woken me up though. Have you had any work done on that tooth before? Fillings or crowns? I think there's a old filling there from years ago. Alright, well, we're going to take a look, do some x-rays. Sometimes this kind of pain can be from a cavity, a cracked tooth, or the filling leaking. Yeah, I mean, it's been getting worse, so I just figured it'd be best to get it checked out. Totally makes sense. If it's a small cavity, we can likely do a filling. If the nerve is irritated or infected, we may need to talk about a root canal. If there's a crack, sometimes it needs a crown, depending on how deep it is. I'm hoping it's not a root canal. Fair, and we'll know a lot more once we look at the x-rays and the rest of the teeth. For now, let's try chewing on the other side, avoid really cold drinks, and take some ibuprofen if you can safely take it. Okay, so what's the plan today? We'll examine it, take your x-rays, and I'll walk you through the options before we do anything. When you're done with the patient visit, you just want to click that red stop button in the top. Since we'd already pre-selected all of our settings here, we're just going to click this green generate note button. And you can watch the magic happen. So as for sending to MacPractice, you're just going to want to click this green button in the bottom right that says send to MacPractice. It's going to show you a box that'll pop up in the middle of your screen right here. Note sent successfully. You just want to click this done button. We'll go over to MacPractice and make sure that it's appearing in the patient profile. So we have Andrew Johnson, that is correct. If we go to the clinical view, we have our pending note here. If we double click on that, we're going to be able to make any last minute changes in this text box on the right and review the note. And then we're just going to need to confirm patient assignment, and then we're able to approve the note. Once you approve the note, it's no longer going to be editable, so make sure that you have completed all necessary changes before doing so. You are also able to see all of your Claio notes in one spot on the left. You see this Claio Notes Management tab. If you see, we are on pending approval here, so these are only going to be your pending notes, and then if you switch to all notes, you'll be able to see your approved notes, your drafted notes, and your pending notes.